there will be this or that violence. That is unacceptable. All of us must commit ourselves to having free, fair, peaceful elections. It is what we owe our country, all of us. We owe it to Kenya to have a peaceful election and a peaceful country. Na sote tufanye kazi kwa pamoja. Ni sisi pia ambao tutasaidia IEBC. We must give the IEBC a legal framework that is practical, that gives them the best opportunity to deliver a credible election. It is our responsibility. It's the responsibility of Parliament, it's the responsibility of us in the executive, it is the responsibility of those running political parties, that we create the necessary law to enable IEBC to deliver a credible, peaceful, and transparent election.
All right, let's cross over to Afya House now. Cabinet Secretary, Finance, Health, and Sarah Serem from the SRC speaking on the looming strike by health workers tomorrow. This is coming to you live here on Checkpoint. Let's listen in.
The declared doctor strike, which we have been discussing the whole day. But before I say our position, I want to introduce those who are around the table. Of course, I'm with my colleague, Henry Rotich, who is the Cabinet Secretary for National Treasury. On my left, we have Governor Ongwae, who is indeed the Chair of the Human Resource of the Council of Governors, who has been with us the whole day. And on his left is the CEO of the Council of Governors, and Mr. Njoroge, who is the Director of Human Resource Management in the Ministry. On the right of Henry Rotich is Geoffrey Mwau from the Treasury. And we have Dr. Nicholas Moraguri, who is the PS in the Ministry of Health, and Dr. Kyoko, who is the Director of Medical Services. Just as a means of background, of course, I know that the ministry sometimes in 2013 signed a collective bargaining agreement with the doctors, which has been subject of court proceedings for some time. And sometimes in October 6th, the court ruled that we go back to the drawing board and we engage in discussions about that collective bargaining. If you may recall, that collective bargaining agreement was signed at the point of devolution, and therefore a new structure of government for central government, that is the national government and the county government, had come to effect. And therefore, this collective bargaining agreement could not be registered then without the input of the county governments. Now, this process has gone on in court until that ruling was given, and the court gave the parties who are enjoined in that petition 90 days from October 6th up to January 5th to be able to discuss and come up with an agreement which can lead to registration of a collective bargaining agreement with the industrial court. Now, first, that process is not complete because the 90 days are not yet over. We initiated discussions with the doctors, with committees to be able to continue with the deliberations so that we can meet the ruling of the court. But along the way, the doctors kind of negated on the discussions and gave us 21 notice for strike, which comes to effect in midnight. Further discussions with them led to an understanding that today we shall be meeting at 5:30 to be able to take further that discussion and perhaps come to a conclusion to be able to avert the strike and also to move forward with the negotiations as stipulated in the ruling of the court. During those discussions, of course, the Minister of Health or the national government involved the county, and that is why we have been with Governor Ongwae all through those discussions. On our part, we have consulted widely with the National Treasury, the SRC, the Public Service Commission, and other agencies or stakeholders who could give input to come to a conclusion on that matter. Let me say, all along we were negotiating in good faith, and we still believe that it is not necessary for doctors to go on strike. Now, part of that ruling and part of that collective bargaining recognized that there was harmonization of the scheme of service and the grading or a job evaluation which was being done by the national government to be able to bring harmony within the public service. And that agreement did recognize that any conclusion to that CBA should take into consideration the input of SRC and in particular the conclusion of the job evaluation exercise, which has been now concluded, and discussions have taken in various levels of government. It has come to effect last week and is in the process of implementation. And therefore, this is a document which is in the knowledge of the doctors and knowledge of anybody in the public service. That document will be able to guide us as we move forward. And therefore, any engagement we are going to have with the doctors should take into consideration that document, which is a government document, which is recognized both at national level and the county level as a tool which can be able to harmonize how we conduct business, the grading of staff in the public sector, and also making sure there is compensation based on each job. Therefore, the tools are there for us to be able to engage. What we were looking forward this evening is to be able to meet the doctors' negotiation committee to be able to come to a conclusion of this process. Now, of concern is the notice they gave, which in our view was premature because we had not completed the 90 days which were given by the court, and secondly was preemptive of the process which government has taken 3 years to develop a document which is going to form the basis of upgrading public servants and also compensating them effectively. Therefore, we still believe. We do not know the reason why they didn't come. We can only infer that they are meeting and consulting, and we shall continue to extend the goodwill for negotiation until this process is concluded. What I can say, I hope that services within our public institutions, both hospitals and health centers across the country, will not be disrupted by any action which can cause suffering to patients. And therefore, I appeal to clinicians, doctors, and other health workers to continue providing services to Kenyans wherever they are employed to do so, recognizing that the national government and the county governments are committed to the process of having sound industrial harmony within their areas of operation. As we speak, I'm aware that the county public service boards are meeting in Mombasa to be able to come up with a common framework to be able to deal with the issues of collective bargaining agreement and understanding between the doctors and nurses and other cadres within the counties, so that we do not have a disjointed process of engaging with the health workers within the county government under the umbrella of the Council of Governors. That effort is commendable, and we believe it will give us a framework of engagement. I want also to say that that group is also discussing recognition agreements for the various unions which exist within the health sector. Therefore, there is effort within the government collectively to be able to address the plight of health workers. I think any other reason which I might have been, put forward by the clinicians or the nurses is not the correct position, and therefore our doors still remain open for discussions tomorrow and the day after to be able to come to a conclusion of this weighty matter, which we believe if they carry their threat, then it will not be in good faith, because we are prepared to be able to engage and also come out with a permanent solution to the problem which is affecting the sector. The presence of the various agencies of government here today is an indication of that commitment. And I think at that point, maybe I will allow Governor Ongwae, who is representing the Council of Governors and indeed the counties, to just give his perspective, and then thereafter ask the Cabinet Secretary, National Treasury, Henry, to be able also to give his perspective on this matter. Thank you.
Thank you very much. The two Cabinet Secretaries who are here, the members of the Fourth Estate who have come at night. It's now 9 o'clock, a few minutes past 9 o'clock. I do want to say that as a governor,